Hi, good afternoon everyone, and thank you NCCM for the invite, and apologies that the agenda in the thing printed is wrong, and we need to owe up to it because a very last minute we actually decided to change the topic slightly, right? So we wanted to talk about health system strengthening, and then we were thinking that there are two tracks actually, right? So my colleague will be speaking right after me in the next Jason Hall about health system strengthening, and I decided to focus a bit more since it's an ally health track. I thought we'll talk a bit more on collaboration, because one thing I see for sure, although over the past few years we were quite successful in a lot of collaboration and partnership, there's still a bit of hesitance, especially when collaborating with the industry. So that's why I thought I will actually share a bit of our experience on what we have done in Malaysia. So before going further, definitely, as you all heard, this is my disclosure, full-time employee of Novartis. A bit about Novartis. So we are present in 155 countries where our products are actually sold. We have reached out to 769 million patients worldwide, and we reach out yearly to at least 66 million patients through our access programs. These are our Healthy Family programs, which I will actually share a bit more about later on. So why we are able to do that is because we exist in 6 different locations, and we have our in-house Institute of Biomedical Research. So if there are students in the hall today, you can actually look up. I personally know at least 2 or 3 Malaysians who are located here in San Francisco, and they are actually doing research on neglected tropical diseases. So it's somewhere to actually gain experience and perhaps come back home and make some impact in Malaysia. So that's one of the reasons a lot of our drugs are actually produced in-house. So around 20% to 25% of all our profit goes into research. So we have about 20,000 employees worldwide who are only focusing on research. We have about 300 plus drug programs running currently, and then one of our promise is definitely to make a breakthrough treatment, always try to address the highly unmet need. And how does that impact locally in Malaysia? Definitely we have been able to bring in the most clinical studies in Malaysia. This was an award given by CRM back in 2022 because we were the top sponsor for that collective years. And where are we today? Even today we have 78 studies running for the next 2 years, and this is the current commitment, not including any new studies coming in, and which will actually give a very good impact on our local GDP as well. So this is the survey which was done last year by V4, which actually shows the social, environmental, economical impact created by Novartis alone. And what it says is last year itself there was 312 million USD worth of impact in Malaysia. We reached out to 1.2 million patients, and which actually increased quality adjusted life years by 11,000 years. So what it means in short is actually summarized over here. Every dollar spent on Novartis medication actually give a return in economic by 2 ringgit. But all this said, the issue in the hall today is actually about prevention, right? The drug costs are increasing, and this paper, which was published back in 2014, actually says that the full research cost from phase 1 till a clinical approval is actually $2 billion, and that is about 10 years ago. I couldn't find a more comprehensive reason paper. I'm sure this has gone up at least by 50%, if not 60 or 70. So what we need to do is definitely we need to collaborate. Like I already mentioned earlier, we need to first of all quantify what is the disease burden in Malaysia, which is one of the biggest problems in Malaysia. We do not have enough registry. A lot of times we are not even sure, we can't even forecast what's going to happen in clinics next year. So that's why my main topic today is actually public-private partnership. And when we talk about public-private partnership, actually this question I get most of the time. Why would pharma want to collaborate with MOH or a charity organization? industry is profit driven, which is true. And on the other side, the taxpayer, of course, government has a commitment to the taxpayers because it's a social value, a social commitment which they have to follow. So how do we balance these two, right? So that's the main problem which we usually have. Although yes, profit itself is actually to help sustain, to help innovation, to help give back the commitment which we have to our investors and employees as well. So how do we actually try to find alignment? It's a very nice book which is actually written by Howard Buffett, and if some of you all are familiar, probably you all have already guessed it right. This is Warren Buffett's grandson, right? And the topic which he talked about is about investing in social values. So how can the industry and government align, or how can the charity, NGOs, government and the industry align is through one vision that what we are investing in is in social values. And how can we do that? So there are five processes which was five things which was highlighted, which is process, people, place, portfolio and performance, right? So first thing is on processes. So that means we need to have a proper framework. What are we actually trying to achieve? When different parties, different stakeholders sit down, that's the most important thing, to actually have a framework. Second is people, right? If people who don't want to collaborate, my learning is very hard to change the mentality, right? It's better to find a different stakeholder because you probably can move faster. Place, of course, you have to define your geography. Third is portfolio, and especially for today's team, I think this is very important. When we talk about portfolio investing, that means we don't only talk about investing in drug access, we also talk about prevention, right? We also talk about early detection, early diagnosis, early treatment. It cannot be only one or the other. And last, which is always an issue in healthcare, I feel we always fail to measure, right? Government came out with a circular a few years ago when I was still practicing, that every single quit smoking clinic which we will open, we will monitor how many people actually quit, for how long, and what was the impact. But unfortunately, we keep forgetting about that, and we never measure our performance. And that's why actually it's very important that even a goal, 6 months goal, 1 year goal, 5 years goal, we have to measure. We often come up with national KPIs which are 10 years long, but we never measure what's going to happen in next 1 year. So I found this book great, and actually they gave two examples. One is a very old example. I don't know whether I can call this modern history's first public-private partnership, but it's a major one, right? Because this is the Eisenhower interstate system. So this is the first time US government actually collaborated with the industry to actually really link US from the east to the west. Another great example which was given was very recent, but this was a mammoth of a task, where Digital India Initiative. So imagine a country of 1.2 billion did not really have an identification card. I think for most of us Malaysian, it will be very surprising, right? Most of us, when we were born, everything was already digital, probably slightly before I got my first one. But yeah, so everything was already digital. We have been seeing chip on our ID card for a very long time, but in India, this was a big issue. And even when they started in 2011, you see the pickup was very slow, till they actually brought in a private industry, which was Infosys. I'm sure even in current climate, a lot of red flags is already in your mind, right? Even right now for Pandu, when the government is actually working with Touch and Go, it's already raising a lot of red flags. I don't want to register. Touch and Go will get all my data, but it's an important step actually to bring in. To bring in the private industry, because you see where did they go in the next 4 years, and more important is the amount of saving which they had, $11 billion saving per year because of corruption. They actually saved a lot from their fuel program, and then also they actually created an entire market for how many people who are on mobile and on Facebook. Well, that's Perhaps a bit easier when you talk about other industry. It's a very nice quote before we go on, that the across sector partnership is actually really in today's day and age not only something we can explore but something critical if we want to overcome the disease burden which we have, which continuously rising today. So perhaps a bit easier said than done in other industry, but when we talk about healthcare, we also have another issue, which is being ethical. Being ethical, right? So we're talking about patient data privacy. Are we giving the right drug to the right patient at the right time? Are we screening the right people? Is it the right even age group? So how do we ensure that when we are approaching similar models in healthcare, we actually go with the similar intention, with a good intention? So this is a Singapore statement which was published in 2010, and this is a very important statement which actually encourage us that whenever we are actually doing something in research or in healthcare, especially for collaboration, this is something we can follow. And one of the most important thing which they highlight is quite similar to what was mentioned in the book itself. We have to come out with a consensus statement. And the consensus statement say what is our objective? What do we want to achieve? Who will actually have an impact from it? And very similarly, Novartis has a similar but slightly more elaborated framework where we actually talk about if we are collaborating with any NGO, any non-profit organization or MOH, how do we need to put in the framework? So we need to look at what is the mutual benefit, what is the common goals, collaboration and transparency is very important, right? Supplementary expertise, so why people are coming in together is not only for benefit but also to supplement each other's expertise. Ethical standards that we have to continuously adhere to that. Sustainable solution, we want something which can continue, so not a big goal which will start today, and we have seen that so many times. We have started screening programs which lasted only like 1 or 2 years, different ways we have tried to do. Sometimes it was too exhausting for us, sometimes too exhausting to our budgets. So we need to think about solutions which can continue. And lastly, of course, flexibility and adaptability. Very quickly to share a few examples that this framework has actually been put in live and it actually has worked. This is our Healthy Family Initiative and this is a 10-year report. So in the 10 years we actually reached out to 40 million patients, and this is in 4 countries altogether: Vietnam, India, Kenya and South Africa. So in those years about 3 million patients actually received treatment in the camps, and it's not only treatment, it's also the screening or basic screening for infants, for babies, for adults. At the same time, 51 products or portfolios was actually through compassionate use was provided to these countries in 6 different key therapeutic areas, which includes cancer and non-cancer. And then of course the full-time field, we actually managed to hire 522 full-time employees. Another initiative which is very close to Novartis, and we continue to work on tropically neglected diseases, and malaria is something definitely we have collaborated with many governments around the world, especially in Africa. So as you know, the burden is quite devastating. We still have about 241 million cases yearly. Even in Malaysia, we have some endemic areas which continue to affect our patients. So what is our commitment is basically since 2000 we actually have delivered about 1 billion, and most of these doses, more than 70% of these doses are actually provided on compassionate use, so it's provided for free. And one more example which I want to share, 2 more examples I want to share, those are actually local examples. So in local examples, one of the things we have been focusing a lot is definitely registries. So to actually really quantify what is the burden in Malaysia. So there are a few examples here. One of the collaboration is with with the Public Health School, with Prof. Nirmala, to to really look into happiness registry for advanced breast cancer patient, which we think is very important to actually identify what is the happiness level and what is the need of patients who have been diagnosed already. Second is, I will talk a bit more in detail about this. This is probably one of the largest registry we have right now. Second was actually really to focus on dyslipidemia. If most of you all have gone through the morbidity survey recently, you know that more than 50% of our population has dyslipidemia or high cholesterol, and this is one of our longest registry which we had, was really to capture heart failure patients. So this was running for past 5 years. This will be the last year, and we are still scratching our head how are we going to make that sustainable. So that pillar just now when we talked about sustainable is really important. Even after 5 years of initiative, we still don't know that what is the exit plan or how do we make this sustainable. So the last two are also registries, one in OFTA and one more in rheumatoid disease. This is just to give you all example that, and these are not all, and I really apologize if there's any collaborators in the room whose study is not on board, because we have actually more than 20 studies running. This is just to give a flavor that we do have studies in almost every single domain. For some reason this went black and white, I'm not sure why. So again, this is the current study running, which is perhaps one of the largest registry. We have more than 3,000 patients to recruit. Of course, it depends on how many dusty files we can also find and brush off. So this is past 10 years data, including next 3 years prospective data. So this is really looking at myelofibrosis, which include leukemia, PV, and also essential thrombocytopenia. So the objective is first to at least know what is the disease burden, and how from there, what are the initiatives we can start. So if even tomorrow we are starting any initiative for screening or for prevention, at least with the existing registry, we can see how many new cases are actually being diagnosed. So at this point, we don't even have a clear benchmark. A very old paper says that it's about 140 plus patients a year for CML, but I think that's all what we have. And lastly, on a more fun note, going a bit beyond research, is actually our companion, and you can actually see this poster or ask us more about this at our booth as well. This is an app which when we started was actually to bridge breast cancer information gap, but today we have already extend this to 2 other therapeutic areas, which is for CML and myelofibrosis. So the need for this app was actually highlighted through our various patient surveys, that the knowledge which the patient need, they often do not get, and when they actually end up on Google, they are going everywhere, right? So either they fall trapped into some other treatments which could have been as a complementary treatment but not their primary treatment. So we developed this almost 3 years ago, and today it has quite a few functions which we continuously try to get and learn from our patients that what exactly do they need. So of course, some of the most important thing which they have told us is medication and appointment reminder, because some of them who are going through this journey, there are a lot of things to figure out, and they often forget their medication, they often forget their appointments. So lifestyle information, disease information, and tomorrow if you guys are going to stay here till Sunday, please come and join us. We are actually collaborating with NCCM to announce one service which they will be putting in this app, which is the counseling service. So beyond this, I don't know where will we go. I think what we want is the feedback from our patients to see where can we go, but of course the idea is if we can also tomorrow start a prevention campaign on this. How can we also reach out to public? Right now this app is fully working together with the patient organization, really focused on giving companion support to the patient. But how do what would be the next step is something we're still trying to figure out. So of course, if anyone have any suggestion, after all said and done, we all know that When we talk about collaboration, it can be done, and in healthcare, when we're talking about it, we need to keep in mind ethical collaboration. How do we do it? We need to maintain the ethical principle, be transparent and accountable. Public-private partnership is definitely the way to go, because we can actually invest in social values and make sure that we can really transform Malaysia tomorrow. So let's shape a bright future for Malaysia. And if you have any questions or any suggestions, please do. You can write to us at mymedinfo@novartis. And if you're interested to learn more about the app, you can actually scan the QR code and download the app. Thank you.
Okay, thanks, Dr. Baraj. Yeah, so now we are moving towards the Q&A session. Yeah, just in case you all have any question, you can post it. Yeah, so maybe without shy, as a chairperson, I will take the advantage to kickstart the questions first. So myself actually involved in some of project on the prostate cancer. So part of the European Horizon Run with my collaborators. So we are collecting the prostate prostate cancer patient urine. We look at the biomarkers part, we try and develop. So anyhow, so just now just posed to Dr. Baraj that with your sharing just now, you got different projects which is like ongoing for the registry. So one of it is like 5 years, right? It's been 5 years, and I guess that sometimes we kickstart a project with a good intention, but when we move to a certain stage, perhaps the question will back to us is what is our visions and how you're going to continue. Yeah, so with that, so many projects that you already done and you are leading it, and your experience, from that you're trying to summarize what would be the new idea or perhaps the new strategies to kickstarting the new one. So from Novartis standpoint, yeah. So perhaps I think that is far more important for us. Yeah, your view on it.
So I think we learned a few things, right? When we are starting a mega project like a very big registry, nowadays we often try to see if beyond Novartis, any other company want to come on board. Because a lot of times for us, we do have the funds, we can invest, but then sometimes it's a short period of time. So if there are few companies, I think sometimes the project become a bit more sustainable. So I think when you're looking for funds, you're looking for collaborators, it's good to have more, right? Rather than, sometimes it's easy to get the first person, right? But then if you have a few more, I think it becomes a bit more sustainable. First thing, and I think even solutions, right? Previously, we did not have many ECRF platform, data management platform. So what we used to do is we pay a lot of money upfront to actually start the project. But then now, if you collaborate together with Institute of Clinical Research under NIH, the government actually have their own vendors like RedCat, and the data is hosted locally. So I think this kind of solution actually ensures the data is within the country and at least still with the government. So I think those are the things which I feel these two things are important to make sure that the project can continue for a long time.
Okay, thank you, Dr. Baraj. Yeah, RedCap, if let's say is a university, basically you get it free. Yeah, just request for it. Yeah, thanks. Yeah. So, any questions from the floor? Yes.
Hi, I'm Fun Fong. I would like to ask Mr. Baraj, like when it comes to public-private collaboration, I understand that your pharmaceutical companies do collaborate with CRM. So the thing is, when you come up with an application, which is good because it's more like you do research that's more targeted towards the Malaysian population, right? So you also use the government's facilities for the patients and all, right? So overall, after doing all these things, do you actually make the drug cost lower?
I think this is a very good question.
No, true. I think it's important. So first, I want to start by saying that when you see that I said that 1.2 million patients we reached out to last year, One thing which I find fun working in Novartis is because a lot of our medicines are reimbursed. And why they are reimbursed is because we have programs, our cost is definitely much more affordable. Whether is that the case for every single medicine, to be honest with you, no. And like I mentioned, even in 2014, right before the drug is launched, the baggage which is carrying, or the expectation is the drug will at least make 2 billion. So the overall, in entire world. So it is getting tougher. It is getting tougher because this is before marketing, right? That means it's still not paying my salary, still not paying all the employees' salary in Malaysia. So it is getting harder, but I think the advantage which we have is the legacy where we have so many different programs, we have so many different compassionate use programs, and at the same time, the data which is generated in Malaysia, it actually can show that is it really effective in our population. So I think that's the two advantage which we have.
Yeah, because I'm just thinking like in terms of taxpayers' money, so there should be some kind of middle ground somewhere because drug costs is very expensive, and the compassionate drug costs that are selected, they are only selected for certain patients, you see. So it's better that it's like more affordable, it's made more affordable for everyone across the board.
Thank you.
Can I ask a question now? In terms of the app that you're creating, because we know that Malaysia will eventually have a super app, right, for health system for patients. So how does that put your app into that ecosystem?
So to be honest, at this point, I don't have an answer. That will it be linked to that? Will it just have an eventual death at some point? So all we know at this point is actually we have about 2,000 plus patients, and in the last survey we pushed out, I think about 500 patients actually answered. So at least there is engagement. But I think the best thing is to continue that conversation, right? We are supposed to go and talk to DHRI as well to see that together with the government, what can we do? And the idea is, like I said, to continue to listen, to continue to get feedback that where can we go. But I'm not sure.
So just to, I'm sure there are researchers in this group, right? So the problem is duplicity.
Yes.
Right? So I've sat on many panel, research runs and all that. Everybody's trying to do the same thing. But the technology is not that fantastic.
Yeah.
So it's just that I think we need the higher ups to actually have the vision,
Correct.
and so that all of us can follow into this line.
Correct.
In pipeline, right?
Correct. I think either it's coming from top down, or it's also what matters is what are the services we are providing. So I think it's a very good collaboration which we will have with NCCM. At least we can provide counselling to the patient, which is very important in a lot of these areas.
I want to question over here.
Thank you. Thank you, Dr. Raj, for a quite an insightful session. My name is Dr. Joan Paulo, I'm from Kenya, Ministry of Health. I have a question about, two questions actually. The first one is on access programs. Do you have any access programs as Novartis? Because I think that's another PPP element. We have access programs for some cancer drugs in Kenya with other pharmaceuticals. So I was wondering if you have any. And then my second question is, the topic was titled, the ethical bit. And I was just wondering, what are some challenges maybe you have seen or experienced in these private-public partnerships, and when does it become an ethical? What are some of the ethical practices you may have seen, and then how do we avoid that? Thank you.
Okay, no problem. I think I'm loud enough. I think the first question first, right? The Healthy Family Program, I'm quite sure it's running in Kenya because even only last year there was an article on it. But if you're talking about any specific new medication, do they have access program? By default, most of our medication we are allowed to start access program, but we need to know that what is the exit point. Are we going to register the drug in the country or not? So that may be a hurdle, but at least the healthy family program is definitely there. And you can always request because we get the request, and once we have a plan to launch, sometime 4 years, even 5 years before the medicine is launched, we start the compassionate use program. To your second point, I find always the biggest challenge is actually data privacy, because whenever we collaborate, we need to make sure that the data when it transfer to the company cannot be identified, no one can contact the people. So and where do we store the data? I think that is one of the biggest issue. Even right now when we are talking about collaboration on the counseling, we need to submit details for to contact the patients, but cannot be submitted in the app because we cannot have whatever data we have in that app. Nothing can be identified. We don't know who are on the app. So these are the things which we need to figure out. Sometimes end up we cannot collaborate. End up we spend a bit more to make sure that the two servers are really far apart. But this is one of the biggest challenge I usually face.
Can I ask one more question?
Just to call what the Barash mentioned. I think cross-country data transfer another issue as well. You need to take into considerations the data for each of the country privacy. Yeah, PNC. So you can't be just transfer data from one country to another country. Yeah, sometimes this is a problem that researcher has when you are in the big console. Yeah, but that's a way.
Happy to answer, but anyway, if you all need to conclude the session, I'm here at the booth until 5.
We have an extra time for this, so feel free to have a discussion. But
because there's another.
yeah, you're going to be. Okay, so I think next.
Okay, I do not have any systematic question, but a very general one. That's a very interesting talk, Dr. Balraj. So, like this private sector is growing in every country. I'm from Bangladesh, in our country as well. So I just wanted to know, in this sort of PPP when we make, is there any way to prioritize the patient care above than the commercial interest? And if you are informed of any measure to monitor this type of partnership, I would love to hear your thoughts about it.
Definitely. So, like I said, my colleague is presenting in the next room, and his topic is health system strengthening. And when we designed that about 2 years ago, we actually presented that to the health minister. So it has 6 pillars altogether, and 2 of the most important pillars was actually, but in the next 5 to 6 years, we also need to focus on screening. So I think, like I mentioned, and it was also highlighted again, that definitely drug costs is getting higher, access to treatment is getting higher. So a lot of companies do provide flexibilities, but we also have some hurdles on how much. The more we invest, every dollar we invest, actually it turns out patient have to pay out of the pocket or the government have to pay, right? So that's why sometimes even all the IIT research request which is coming, we try to cut it down, because everything we spend on, eventually the patient have to pay it back. So I think we cannot say that we cannot look at profit, because profit is important to be sustainable, to continue to research and to continue to innovate. But what we can do is that notion over there, the social values, right? That what we need to focus on is definitely patient outcome, patient care. How can we make sure that one of the biggest problem we have in this country is also we start 4 patients on treatment, only 1 will come back. So when the government has already spent the money, out of 4 boxes dispensed, 3 goes to the bin. How can we make sure that patient actually adhere? Right? One of the main point of this app was how do we make sure that patients stay on treatment. So I think your question is very valid, and whenever you're collaborating, need to come out with that statement, that consensus that what we want to achieve, our KPI should be in 5 years, patient outcome should reach here, and then break it down to screening, diagnosis, adherence, and of course treatment access, where companies' interest will be that we will increase treatment access through this collaboration, but it should focus on all 4 pillars, not just one thing.
So let me ask one more question. I think probably she's enjoying the tea then. So I need to ask her some question. Actually, the question would be like, I mean that it's a general statement that we say that preventing is better than cure, right? Which is that's the reason that end up sometimes perhaps the overdiagnosis might be occurred. So maybe when you've gone through your presentation just now, I have 2 simple questions. The first question, when you mentioned about the analysis of the French country, so there's around 200 million euro actually. So what is the percentage in terms of the total expenditure for the medical cost? 200 million is how many percent out of it? Yeah.
Oh, that's a very good question.
We didn't estimate the total cost of medical care in the whole France because we couldn't get those data. But for thyroid cancer alone, that over treatment can contribute around less than 40%, like 40% to 60% of all thyroid cancer treatment costs in France. Yeah, so it's a large number for that specific cancer. Yeah.
Thank you. So mainly what I'm asking about the percentage is that if let's say percentage is not really high, then back to that statement just now, preventing maybe is better than cure. Yeah. Okay. Then the second question is more towards like based on your research, we actually found out majority. I mean, like main of the focus of the research on thyroid cancer, right? So is there any specific reason why you work on this specific cancer? Is that easier to screen and so on?
Yeah, for this cancer type is very special because it's like it's very typical where overdiagnosis can occur. Is on the surface of the body is very easy to detect it, especially since the 1980s when ultrasound became available. You can check it with a very small amount of money, and the ultrasound can give you very accurate result. And another reason is different cancer types, they have a different reservoir among the population. For thyroid cancer and prostate cancer, these 2 cancer types have the largest reservoir of subclinical cancers in the population. So it's so typical, and we want to use it as a start to recognize, to acknowledge the problem of overdiagnosis in cancer in general.
Okay, thank you. So I think we need to call the sessions, just wrap up. And just want to say thanks to Baraj, thanks to Prof. Lee for sharing, and thanks for your time. So hope you enjoy the rest of the day. Okay, thank you.